death in this country, and we need to do everything possible to prevent heart disease. And yes, heart disease is preventable. You can do it with nutrition, for example. So according to the American Heart Association, there are 7 factors that we need to consider when it comes to heart disease. One is blood pressure, cholesterol, reduce blood sugar, get active, lose some weight, stop smoking, and eat better. So these are the 7 factors that the American Heart Association recommend to work on in order to prevent heart disease. And as you can see, among these 7 factors, 5 are related to nutrition. Like eat better, it's food, of course, losing weight, nutrition, okay? Cholesterol is a nutritional issue. Blood sugar, nutrition. Blood pressure, nutrition. So nutrition is the key, is the foundation to prevent heart disease. And yes, it is possible to prevent, and it is possible to reverse heart disease. I will give you a few cases to show you that we can do a lot with nutrition. For example, I had this guy who came in with really high blood pressure, and for him, it was, at the end of the day, deficiencies in potassium. So there are 2 main things causing high blood pressure. One is magnesium deficiency, and the other one is potassium deficiency. In his case, he's been on high blood pressure for years, many years. And one of the side effects of high blood pressure medications, all medications for blood pressure, lead to potassium deficiency. So over time, your body loses potassium because of those blood pressure medications. And it's a vicious cycle, as you can see, because you take blood pressure medication to bring down the blood pressure, but it leads to potassium deficiencies, and potassium deficiency is the main cause of the high blood pressure. So over time, people actually depend on their blood pressure medication, and usually it gets worse over time. So you have to take stronger medication, or they have to add medication over time. I don't know if you have experienced that. I have. When I was suffering from high blood pressure, so I started with 1 pill, and over time they added more pill to try to keep the blood pressure down, because the actual cause of the high blood pressure was not handled. And in this case, in this patient's case, was a potassium deficiency. And sometimes it is either or and magnesium deficiencies. So these are the 2 main things that we need to look at, address when you have high blood pressure. One of the main side effects of those high blood pressure medication is a heart attack. It's heart failure over time. It's a bit ironic that that's the case, because we take those medications to try to prevent heart problems, but one of the side effects of it is actually a heart attack. And I've seen that quite often. And like I said in the past, limiting salt is not the answer. Actually, you need good quality salt to bring back magnesium and potassium in your diet. I've never met a doctor that could cure high blood pressure by just limiting salt. That's not the answer. Typically what happens is it may help initially, but over time your body gets worse because you never address the deficiencies of magnesium and potassium. So if you take salt and you have an issue with high blood pressure, it's most likely a nadrenal deficiency. So when it comes to high blood pressure, the main cause of blood pressure issues, it typically comes down to nadrenal deficiencies. And ironically enough, your adrenals need good quality salt to function. So you do need good quality salt. The goal or the key, the answer is not to limit salt, but is to fix the deficiencies in the body, the magnesium, potassium, and the adrenals. So this is for high blood pressure. And then the other aspect of heart disease is plaques. Over time, you may have heard of that there's a buildup of plaques in your arteries. And then if the arteries get really clogged, the blood supply to the heart goes down, leading to a heart attack. So a lot of people associate those plaques with the fat that you eat. which is totally misleading. This is totally not true at the end of the day. So when you eat fat, the fat that you eat does not go into your arteries. So your body breaks it down, your liver processes it, your gut, and then utilize the fat for bodily function. So there's some doctors in the 90s that what they did is they retrieve plaques for people's arteries and they analyzed the component of those plaques. And more than 70% of the plaques that they found among dozens of patients were trans fat. So trans fat is a processed fat that you get from junk food, processed food, vegetable fats, vegetable oils like canola, like soybean, corn oil. And this is the type of fat, actually. It's a fake fat. It goes straight to the heart. It leads to an inflammation of the arteries. It leads to a buildup of fat, of plaques. And this is one of the main causes of heart attack when it comes to fat. But when it comes to animal fats like butter, eggs, cheese, avocado, coconut oil, all those fats are heart healthy, actually. Your heart depends on fat as a source of fuel. So you need fat. You need saturated fat for your heart. So if you don't eat enough fat, what might end up doing over time is your heart might actually start using carbs as a main source of fuel. And when it does that, it leads to some dysfunction in the heart function. And over time, actually, can have a heart problem. So fat consumption is really, really important for heart health. So I had a patient who came to me, he had 90% blockages in his arteries. And his doctor, of course, wanted to do some surgeries on him and wanted to put some stents and all that. And his wife didn't really quite agree with that. His wife wanted to fix the problem because she read that when you do this, it helps for some months, but the buildup of plaques occurs in other parts of the heart of the arteries. So the problem just gets postponed. So I've seen people over the years having one stent and then having two stents and having multiple more stents. It's because the blockages of the arteries happen at different places. So the goal is to figure out what's going on, why, and to fix that. So for him, what we did, we had a protocol. We have a protocol in the office that we use some herbs and supplements that we give him for about 6 months. And 6 months later, he went to see his doctor again and did other tests, and 70% of the blockage was gone. So the doctor was impressed. He didn't realize, he didn't understand what happened. How is that possible? So we give him 7 types of herbs supplements that are known to actually detox, cleanse the arteries of plaques. And then we gave him a good diet. And the diet was mostly a paleo type of diet, which is low carb, a medium amount of protein, and high fat. So with a high fat diet, we could actually reverse his blockages. And now, as far as I know, his arteries are back to being normal. There's no more plaques. Everything is working properly. So these are the 2 main aspects of heart disease that we are dealing in this country right now. One is high blood pressure. More and more Americans are suffering from it. One is because of food they eat, the sugar, the processed food, the magnesium and the potassium deficiencies, and the stress that we are dealing with. And then we need to look at plaques that are burning up into the heart. So we need to ask also why we have those plaques forming in the heart specifically as other parts of the body. Because we don't have a liver attack, for example. We don't have kidney attack or spleen attack. We have heart attack. So why is that? One of the main drivers of this is inflammation, as you can expect. Inflammation coming from your mouth, from your teeth. There's more and more evidence connecting tooth health with heart problem. For example, we know that bacteria or viruses that we may have in our mouth are known actually to travel through the lymphatic and end up to the heart, causing inflammation in heart arteries and leading to a plaque accumulation buildup in the arteries. You may have heard of people having strep throat, for example, and having a heart problem later on. So that's similar connection. So bacteria from your mouth can actually go down, travel to your heart and causing a problem. There's parasites that can do that. There's fungi, there's bacteria, viruses. This is one of the main, if not the main driver of inflammation in the heart arteries specifically. And when the arteries are inflamed, you're all more prone to have buildup of trans fat, like I said, and plaques in your heart. So the goal here is, yes, we can reverse that. We can address what's going on by a good diet and a good protocol using herbs and vitamins to cleanse your arteries. And then we need to look at, like I said, physical activity. So being physically active is a really important factor of heart health. And last one is smoking. We all know that cigarettes can cause a heart problem because it can lead to inflammation of the heart, the arteries, and leading to plaque buildup. Cigarettes have about 400 different types of toxins. So when you smoke, you inhale, you get all those toxins into your body. So what I see with people is over time we need to detox. You may have seen pictures of lungs of smokers. It was all dark. It was all, the lungs were all not in bad shape. So that's the toxin that get into the lungs. So again, we can detox that. We have protocol, we have herbs and supplements. We can detox the lungs. We can remove the inflammations coming from the cigarette. So these are the three aspects of heart health: physically active, nutrition, and smoking. So if you do this, under these three, you increase your risk of having a longer life and minimizing your risk of heart problem. So if you have any question when it comes to heart health, let me know below. Thank you for watching. Have a blessed day.